and flush it out and see what the contents of your stomach look like. If there is active bleeding in the stomach, then it'll look like blood. Now, it's probably, if there is blood in there, it's probably not gushing out, otherwise you'd be actively vomiting blood in front of me. But it could still be slowly oozing blood. And in that situation, that'd be concerning, because we'd have to stanch that bleeding. Now, did Dr. Huang tell you about the tube in the nose?
Well, not in detail.
Okay. Yeah, so basically what we'll do is, it's a flexible, small plastic tube. It's like a diameter it's smaller than this. Okay.
What do they usually use?
Yeah.
To do your thing?
It can be a little uncomfortable because we're sticking some through your nose into your stomach.
Let's face it, it's not a normal thing to do.
But what we'll do is we'll try to numb up your nasal passageways first with some medicine to make it as tolerable as possible. Okay. We're also checking some blood work, okay? Because the blood work will tell us by how much, if at all, your blood level has dropped in your system, okay? And that gives an idea of quantity of blood loss. And there's a bunch of other things we'll check too. We're going to give you some acid-blocking medicine through the vein to try to reduce the damage done to your lining of your stomach, if that's what's going on. And then we're going to have to discuss your situation. If we do think it's from stomach bleeding, we'll have to discuss your situation with the gastroenterologist on call, the stomach doctor, specialist on call. Because at some point, you're going to require them to go in there with a camera and do a direct look at the lining of the stomach to see what's going on. You're going to need that regardless. The question is, when do you go in? Are you going to need it emergently tonight, or can we wait until tomorrow, or at some point to get that done? The reason why you need it is number one, to confirm the diagnosis of where the blood is coming from, and then number two, to treat it. They can actually treat the bleeding when they're in there.
But the sincerity, it may not be as bad as you're all spelling.
Well, that's what I'm trying to say.
The worst scenario.
That's the second. Well, that's the second. The first job is to figure out where the bleeding is coming from. The second thing to do is figure out how bad it is. Regardless of how bad it is, you're going to need a camera. Even if it's a small bleed and it's minor, at some point, maybe
find out what's going on.
Yeah, maybe not emergently. At some point, you'll need the camera. So, what I'd like to do is get the stuff done, and then we'll talk to the stomach specialist, and we'll get their advice and recommendations as to when they think is a reasonable time to get this procedure done. And just to let you know, I don't know if you're familiar with it, but these are very, very commonly done. They're very common. These stomach doctors do them, do 50.
So it's not a life or death situation.
Well, I don't think it is right now because
I like it. I don't think it
is right now. Well, I can't say for sure without data back, but I can tell you this: your blood pressure looks fine. Right? If people were bleeding significantly, they'd be a lot lower versus now. Your pulse is not too fast. When people would lose a lot of blood, their pulse wants to race, and yours is doing okay. You otherwise are, just the eyeball test. You're looking okay. You're feeling good.
Because, like I told you, when it happened before.
Yeah, but you're lying down.
Yeah, but remember what happened before? I told you within a week, I sort of just to see, I changed my eating habits, and little by little, it fleshed out.
Well, what could have happened then is you could have had a small bleed. You could have had a small bleed that just stopped on its own.
Or the blood has been building up over the who knows how long, and just
possibly
finally flushed
out. When you have dark black stools that's brand new out of nowhere, that tells me you probably started bleeding within the past 48 hours or something.
Because I keep a careful watch on my stool.
Yeah.
I can almost tell by what I eat and how it's going to come out.
So bottom line is, we're going to try to get an idea of how severe this is. My impression is that it's not that bad, and I think very likely what's going to happen, and we'll see what they say, but I think very likely what they'll recommend is they'll probably recommend a next day endoscopy. So they'll probably recommend us watching you in the emergency department overnight and then getting first thing done.
You mean to tell me we're going to spend the night here?
I think that's probably the most likely scenario. I should let you know that overall I think your situation is not dire, but it is a serious condition to have. When people are actively bleeding in their stomach and it's not being stopped, that's actually kind of concerning. And people have died from very large gastrointestinal bleeds, and the reason why we want to keep it overnight for observation is just in case things get worse, you're here where you should be, and things could get worse. So, that's probably what's going to happen. They may surprise me and say, let's just do it tonight, in which case I'll offer that to you as well. Or they may even say, you know what, send him home and we'll see him within 48 hours, which I think I'd be surprised if they say that too. But it all depends, you know, a lot of it depends on the data that we get back from the tests.
Well, I figure I'm here, you might as well go through the
Yeah.
whole damn thing. But at least I was aware of the limited of aspirins. I wish that some of it, my doctor won't.
I mean, honestly, one aspirin a day, that's not.
That's all it's been.
Yeah, that's not too bad. That's not too bad. Now, in your situation, if you're someone who's prone for other reasons to have stomach ulcers, you should probably just stop taking aspirin, you know, for the rest of your life. No aspirin, no Motrin, no naproxen. Those are all kind of in the same classes. You know, if you need something to help you sleep, there's plenty of other medications.
That's what I want to find, is something how I fit. That's the only reason I was doing that, because my doctor, he does not recommend that, because he thinks, well, you may have sleep apnea, and if I give you aspirin, you could die.
Yeah, yeah.
So it's a catch-22. It all depends on who your doctor is.
Yeah.
So,
Yeah. Well.
and those over-the-counter crap, that has nothing in it.
Yeah, those things.
I've tried them all.
Yeah. Okay. All right. Well, we're gonna get started on the tubes soon. Okay.
Okay.
Yeah, we should probably. Is that lighter, Jerry? No. We should. Is that the NG tube? Oh no, this is tube.
No, this is just.
I'm gonna order him some medicine for the NG tube. All right.
Decorative.